I'm Jennifer Tittensor. I am a general surgeon by training, but now for the last 10 years I've just done breast surgery. I am originally from Provo. I was born at Utah Valley Hospital and I grew up in Provo. I went to medical school and undergraduate at the University of Utah and then traveled to Tucson, Arizona and did my residency at the University of Arizona. I came back a couple of years later and have been practicing with Utah Surgical Associates now since 2006, so nearly 20 years. And my practice is primarily at American Fork and Timpanogos Hospital. And when I first came back to Utah, I did all general surgery, took out gallbladders, fixed hernias, also did some breast surgery. But being the only female general surgeon in Utah County for quite some time, I started to attract more women who wanted to see a woman for their breast care. And about 10 years ago, it turned out that my practice was nearly 90% breast surgery. And so that's all I've done for the last 10 years. And it's continued to evolve. I used to see all kinds of breast problems, but unfortunately, so many people are facing breast cancer and need help for breast cancer. That is almost exclusively what my practice consists of, is patients who are high risk for breast cancer or who have been diagnosed with breast cancer. And I often get asked, gosh, that must be a difficult thing. How do you do that day to day? And I've actually found it to be very rewarding. On a personal level, just to get to know my patients so well, to see them over the years and help them get over this hurdle. It's also very interesting. There's constantly new developments in the surgical field, in oncology, in how we diagnose and treat breast cancer in every aspect of that disease. And so it's been a constant learning process. And also, most of the time, people do very well despite having been diagnosed with breast cancer. And it's very rewarding to see people at a point where they need some help, they need some guidance, and you can come in and help them figure out their plan and help them recover from this.